สวัสดีครับ I'm Tom Kambhu นาทยา Board Certified Dermatologist. I complete my dermatology residency at the Institute of Dermatology in Thailand. Following my study, I worked in both disease and cosmetic dermatology at a provincial hospital and a private hospital. A year ago, I decided to open my own private clinic in Surat Thani, Thailand, called Dr. Tom Kambhu Clinic. This gives me the opportunity to treat both medical conditions and patients seeking cosmetic procedure. I perform various of aesthetic operations including laser treatment for pigmented and non-pigmented lesions, high-intensity focused ultrasound, monopolar radiofrequency, needle radiofrequency, fillers, botulinum toxin, and biostimulator products. Currently, there is a trend in Thailand toward radiant and high-quality skin. I trust Gouri as my first biostimulator product for use in my clinic. Over the past year, I have given more than 400 Gouri syringes to at least 200 patients. Initially, I followed the standard cannula and needle protocol. I then wished to reduce the adverse effect, which include an excessively inflammatory reaction. In order to prevent inflammation following injection, I used cannula protocol, which involve a deeper injection in the subcutaneous tissue and avoid the subdermal portion of the upper subcutaneous tissue. Based on my experience, I have discovered that this procedure can effectively reduce excessive inflammation following injection while maintaining a positive outcome. I would like to discuss various situations, this being one of them. A 50-year-old woman presented with fine wrinkles, enlarged pore, and melasma. After 2 sessions, she received topical medication and superficial peeling, but the results were not very impressive. She received 1 session of Gouri with 2 syringes after the last superficial peeling. 6 weeks later, her skin showed improved dryness, reduced wrinkle, and enhanced skin tone. Here are my technique and protocol. Begin by discussing the potential benefit and side effect to avoid any potential negative reaction. I provide pre-medication with 10 mg of prednisolone and 10 mg of cetirizine 30 minutes before the procedure, as well as post-medication with 10 mg of prednisolone and 10 mg of cetirizine for 5 days after the procedure. For example, I aim to use my deeper injection throughout the entire face operation. I will design the treatment to each patient's specific issue, such as wrinkle, melasma. This may vary slightly among patients. In this case, a 42-year-old woman presented with static and dynamic wrinkle, as well as melasma. This is what I'm doing for the Gouri treatment. Initially, making the entry point and the treatment line. Usually I do whole face of 3 lines on each side, starting with the forehead, then another 2 lines on the cheek area. Injected local anesthesia on the entry point. Then I use 27G 50mm cannula, doing silocaine pre-fill the treatmented area. Then continue with Gouri injection. I plan to use 0.2 ml on the forehead and 0.4 ml each line on the cheek. Here it comes. The most important part is where we insert the medication. Usually, I attempt to position it in the uppermost part of the subcutaneous tissue or subdermal layer for maximum effectiveness, but this might result in significant inflammation and swelling following injection. In my technique, I prefer to place it deeper in subcutaneous tissue to minimize severe inflammation while keeping a beneficial outcome as seen in my case file. As an example, this is the usual recommended depth with subdermal. When we lift the needle up, we will see the silhouette of the needle. However, I like to place it deeper until I do not see the silhouette of the needle. In my experience, Gouri is the ideal option for both doctor and patients because of its remarkable effect and safe product, which are made possible by CSAP technology in conjunction with my deeper injection technique. It was an honor to have been granted this opportunity to discuss my case and my experience with you.